voice. And it looks like our numbers are starting to even out a little bit, and we have a lot to talk about today. So we're going to go ahead and get started. Welcome, everyone. Thank you so much for joining us for today's session, Supporting Youth Mental Health in Rural Communities. My name is Jackie Zimmerman. I am the manager of public education partnerships and e-learning at Mental Health America's national office, and I'll be helping to moderate today's session. I have just a few notes before we get to hear from our panelists. This webinar is being recorded and will be emailed out to all registrants within 1 week. We currently do not offer CEUs, but we can provide you with a certificate of attendance. If you would like to request a certificate, I'll post the link to that form in the chat here shortly, and that will also come in your follow-up email. So if you don't get it, don't worry, you'll get it in your follow-up email. We might have some time for questions at the end of our session, so please feel free as our panelists are speaking to ask your questions in the chat. I'll be collecting those on the back end and we'll go through some of those as time allows. So without further ado, we have a great topic to dive into today, talking about youth in rural areas and what kind of support they need, what unique challenges they're facing, how communities can really best support youth mental health in some of our rural areas. And with us today, we have 4 incredible panelists. We have Max Delgado, Amy Bartz, Trace Terrell, and Julie Lux joining us. So I'm going to hand it off to them to give us a greeting, let us know a little bit more about you and what lens you're bringing to today's discussion. If we want to start, I'll have Amy kick us off.
Hello, thank you very much, Jackie, for bringing this panel together. I'm excited to be here. My name is Amy Bartz. I am a clinical therapist, a clinical director. I have been in this profession for 17 years in the clinical world. I live in Northwest Minnesota. We are roughly 5 hours north of Minneapolis. To give a little bit of context, I saw lots of Minnesota and some Midwest there in the chat. So welcome to my fellow Minnesotans. We are considered pretty frontier in the Northwest region. And so there is small and then there's really small. And some of the context that I will be referring to is 7 counties, 8,500 square miles of K-12 schools, 400 kids in a school, multiple communities combined, 2 hours to reach services. So that is my perspective and my lens coming to you today. So I'm happy to be here. Thank you, Jackie. And I'm going to hand over to Julie.
Thank you, Amy and Jackie. Thank you to you and to MHA for this opportunity today. My name is Julie Lux. I am Vice President of Communications for Rural Minds. Rural Minds is a nonprofit organization with the mission to serve as the informed voice for mental health in rural America. The organization is only about 3 years old now, but it seems like it's been a fast 3 years. But it was founded because of our founder and chairman, Jeff Winton, and a personal tragedy in his family with the death by suicide of his 28-year-old nephew, who left behind a grieving family, including 2 twins that were age 3 when he died. So this led Jeff to really realize how much of a need there was, and the fact that that need is unique in many, many ways in rural America. I won't go into the details of Jeff's story, but I encourage you to go to ruralminds.org and to learn more about Jeff's story and about what led to Rural Minds. But the one thing that we found out in our 3 years is that need for young people is a very specific and a very significant one. So Rural Minds has been here recently, very much focusing on young people, and we can talk more about our resources a little bit later, but I will pass it on to Trace for his introduction.
Good morning and good afternoon to everyone who's joining, and thank you, MHA, for the opportunity to be here today. My name is Trace Terrell. I use he, him pronouns, and I'm a 3rd-year public health student at Johns Hopkins University in Baltimore, Maryland. I'm originally from a small town in Central Oregon's high desert region called La Pine, and I saw a few people from Oregon in the chat, which is so exciting because I don't see them often on the East Coast. So thank you all for being here. At the 2020 census, La Pine was about 2,500 people, and 83% of the population was more than 18 years old. So I grew up in a town that didn't necessarily have a lot of young people. And I'm also part of Mental Health America's Youth Policy Accelerator program, which is basically all about bringing peer support programs to the country, and making sure that they are scaled to meet the needs of all young people.
All right. Hi, guys. Good afternoon. Good morning. My name is Max Delgado. I'm a first-year student studying psychology at the University of Arkansas. I founded a student organization called Friends of Rogers in Northwest Arkansas that focuses on community service and mental health awareness for young people. And I'm also part of Mental Health America's Young Leaders Council. Um, and growing up in Arkansas, there was definitely a lot of people my age I was exposed to that lived in very rural um, communities. And I think there's certainly a difference in living in rural America from the South into the North. And I think I bring a pretty good perspective on Southern living in the rural areas.
Thank you all. It is such an honor to have each of you here with us today with your really rich perspectives that you're able to share with our audience. And I want to jump right into it of talking about how you see the experience of these mental health challenges that a lot of our youth are facing, how that differs in rural areas compared to urban settings. And what are some of those unique factors that are really impacting youth in rural areas? Anyone who wants to kick us off can jump in here.
Well, certainly, I think one thing that really differs from urban and rural living, especially as a teenager, is certainly how disconnected you are to most of the things that relate to being a teenager. I know for a lot of people I know, they live 40 minutes, 50 minutes out from any grocery store or any Starbucks. And I know a lot of trends they feel left out of. They feel alienated because they can't participate in a lot of these things. Um, they've most of the time, kids living in rural areas, they're 20 miles away from anything that they really want to be a part of. And with that, they just feel isolated, um, and they want uh, they want to be involved with the other teenagers.
I'm going to piggyback what Max is talking a little bit about as well. Really social settings that are healthy for young people, like recreational activities, youth centers, locations that really let youth come together is so hard to find in our rural regions. And I think that's just huge. To piggyback with that is the transportation piece. So also Max was talking about 20 minutes, 40 minutes to a local coffee shop. That is definitely, that community, the cohesion, the connectiveness that youth need, which, well, I'm sure of it. We're going to talk about social media at some point here and and connection with youth. But the other thing that I wanted to say is access to services. Depending on the type of services, the intensity of needs to services, it could be, very hard to access those. And then the lack of providers going into the field. I don't know in each of your specific regions for our guests here today listening, but we are definitely feeling the impact of professionals and individuals coming into the mental health helping field. So that is a contributing factor that I think about specific to our rural youth.
Yes, and I think that's one of the things, the access is so much less in rural communities, Amy, like you're saying. But the other thing that I wanted to mention and get your input on from the other panelists is just the idea of stigma. it seems like rural communities are so, and in many cases, rightly so, based on being independent, of not showing any weakness, or and so just having that stigma from, not maybe not your peers as much, but from older people in the community, can sometimes be a barrier for young people to want to share their challenges with other people.
I absolutely agree with everything that's been said. And I know when I was struggling with my mental health and feeling suicidal and depressed, I often felt really isolated and alone in my community. And I think for young people experiencing mental health challenges, one of the biggest problems is just feeling like no one is there for you. I know we touched on sort of the healthcare disparities that exist in rural communities. And I think a big thing in my community growing up was having a primary care physician that changed every single year, right? Because there are so many programs out there that incentivize healthcare providers to go into rural and frontier areas, but then they don't stay there, right? And we know that like if we're training people who are from rural communities, and typically they usually come back, and that's a really great thing, but often that doesn't happen. That's not an experience for many young people who are seeking care and treatment. And I think another thing too is just sometimes it feels like virtual opportunities are being pushed on rural communities. And I certainly, in my help seeking journey, relied on telehealth and teletherapy to deal with the challenges that I was facing. But my town just a year ago got DoorDash. And if you can imagine that, if delivery drivers aren't wanting to deliver food in my area, what's wanting a therapist to come there too? Do you know what I mean? And so I think that was a really big problem for me too, is I wanted someone to come into my community to stay there for a very prolonged period of time and to actually develop a relationship that was in person and very meaningful. And I think that's a challenge that we see in so many communities across the country.
Absolutely. And Trace, that's such a good point. The care is so unique for mental health challenges, and really you put yourself in a vulnerable position when you're seeking help, and especially as a young person, having these really difficult conversations with a provider and constantly having to do that with a new provider is so hard, of, having to retell your history or things that were hard to say in the first place. But thank you all. Those are some of the really big ones, and nuanced things that come to mind in these communities. And each of those we could probably really dig into for the whole hour. But I know Amy had mentioned, there's not even in some spaces community centers or these spaces where youth can connect. So I'm curious to hear from each of you of what kind of successful programs or initiatives have you seen that have worked well to address the mental health needs of youth in rural areas?
Um, so I think I could talk about there's a program in Northwest Arkansas called TASK, and that stands for the Teen Action and Support Center. This is a great program slash organization in Northwest Arkansas. They're all about empowering teenagers in Arkansas to take action in themselves and in their communities. Um, in 2023, they served over 750 teenagers ranging from ages 13 to 19. And they have tons of little programs where they teach things like money management. They teach how to navigate college applications, how to navigate standardized test taking, and um, they also provide a space where where teenagers could explore their interests or hobbies. They have a music recording studio where kids with musical talents could have an outlet for their creative minds, as well as providing free to low cost counseling. Most of it is peer support groups, because most of these kids come from underprivileged backgrounds, or they come from abusive households, which is also a very prominent thing in rural communities. And I've done work with Task. I helped raise money for the unhoused in Rogers, and they were just such a great help in facilitating that work, and it really inspired a lot of teenagers and young people in Arkansas. So I think that's something like that, a community center that's funded by donations and private investors. I think more programs like that in more rural communities would really be great for teenagers.
So I am an employee of our organization called Illuma. Illuma is a CCBHC. If you've heard that acronym, it is a certified community behavioral health clinic. So in 2018, we were part of the federal demonstration to move the model of mental health delivery to CCBHCs. So when we began this, we were one of 8 in the demonstration. Our organization has been really at the forefront of trying to get these services into the rural region. And so we serve birth through death, end of life, and are, as the director of the youth programming, the school programming, my commitment is to be in the schools. And so what is successful right now at our organization as a CCBHC is we have received, I'm going to speak a little bit of this meso macro component, is that in the state of Minnesota, we have been a grantee of a school-based mental health link grant for, I think, upwards of probably 18 years. And so that commitment from the legislative piece has just been incredible to be able to be co-located into our schools. The other piece is that we also were able to receive some SAMHSA emergency COVID funding that I think that was in 2020. And so with that 2.5 million that came in through that funding, we were able to expand just hugely my program, and I have many mental health practitioners. So these are skills trainers. These are individuals that are going to be out in the community, in the schools, in the homes. When we do have those community centers, those youth gathering spaces, to really be an integral part of the health and recovery journey for youth and for families. And so by expanding beyond really the therapist and to add in the skills trainer to support that therapy work when there is access to that has been incredibly successful. So because of some of the things that are coming down state federally to support providers, practitioners, the growth, so that we can then try to recruit and retain providers in our Northwest region of Minnesota, has just been incredibly helpful and I guess successful.
An example I would point out, and it's my dream for every young person to have access to this at their school, but school-based health centers. They are absolutely incredible resources for young people. And in Oregon, we are very privileged to have over half of our school-based health centers in rural and frontier locations, providing necessary services for young people across the state and getting their families and their communities and even other people who might be in even more frontier areas access to the care that they need. And so I think school-based health centers are just absolutely incredible. In Oregon, some of them are even able to provide mental and behavioral health services, and they're just a great place to help coordinate care with physical care as well. I think one of their added strengths is just the fact that it works so well within the legislation that's already in place in Oregon. For example, our age of consent is 14 for mental health services. So that means a student after school or during the school day can walk maybe a few steps and go get to the treatment that they need. And it's also a really great place because as a student who, again, struggling with my own mental health conditions, I didn't necessarily want to go to the counselor's office because you really only go in there for one reason, right? And to the other students, it might seem like I was struggling. And at the time, that is just something I was so worried about. Of course, that's not how I feel now, but that's a very real fear of so many young people. And so having this place that is still very accessible to all young people, but still distance enough to provide sort of that sense of privacy is super, super important. And one other resource that I'll mention is Youthline, which is a free, confidential teen-to-teen suicide prevention and mental health crisis hotline. So Youthline first opened about 20 or 30 years ago in Portland, and it expanded through a satellite location to Bend, Oregon. That's about 30 to 45 minutes away from where I lived. And I was very, very fortunate and privileged to be able to volunteer with them. I had reliable transportation to go there to volunteer shifts. But one of the things that Youthline did really well is that it partnered outside of all of the like crisis services that it was doing to young people and offering to young people across the country. It also partnered with local school districts to help them offer free mental health education classes through peer or near peer teachings. And I think that is so impactful for young people in rural communities to see that there are other young people just like them who are talking about mental health and having those conversations and fighting that stigma from the very start. So I think thinking about these really innovative community partnerships are a really amazing way to also bring awareness to youth mental health.
And Trace, I think one of the things that you just said about peer to peer is very important. And one of the things we don't have boots on the ground per se at Rural Minds, but one of the things that we are currently developing that could be a service to all of these things that you've been talking about, and I've been learning wonderful things about, but also to just individuals who want to be helpful, young people that want to learn more, or their families that do, is Rural Minds has what's called the Rural Mental Health Resilience Program. And we are currently launching a specific part of this, and I'm checking my notes here to get this right, rural teen and young adult mental health peer-to-peer support program. And what this is a free online toolkit where anyone can go online to the Rural Minds website, ruralminds.org, and download a variety of different types of informational materials. So this can be ways to start a conversation. If you see a friend who's suffering and you think might have a challenge, this is a way that you can help them. So starting that conversation, a lot of times, and I don't know about how the other panelists feel, but some of the things we often hear and experience is people are afraid to start that conversation because, they afraid maybe I'll make it worse. I might not say the right thing, but here are some resources that are available and absolutely free to anyone to help them start that conversation. Be that sympathetic ear. One thing we talk about a lot is how, we as human beings, we want to be helpful. We want to help people. And sometimes the very best thing you can do is just be that sympathetic ear. Just listen to what someone else has to say. So there's fact sheets, there's toolkit information about all kinds of different things that individuals can do to help and to support their friends and family when they think that they might be in a mental health challenge. But again, the thing that's exciting about this, all free information, easy to download, and changing all the time. We're adding different resources and new things to the Rural Health Mental Resilience Program all the time.
Thank you all. Um, Thank you for all of those really unique perspectives of different ways that we are working to address this issue. I know a lot of people have been posting links. I tried to keep up and post each link in the chat of what each presenter was talking about, but don't worry, that will also be included in your follow-up material. So we will include all of the programs discussed so that you can go back and kind of dive into some of these areas and look at what other communities are doing and what resources are available. I want to go back to one thing though that Trace brought up and kind of dive a little bit into this role of schools. And I know Trace, you talked about how you've seen schools really make an impact in this area. And I think it's such a key part when we're talking about youth mental health in rural communities because youth are in schools. They're already there. It's kind of this built-in support that we can utilize. So I'd love to dive a little deeper and just hear from each of you on how you really see schools playing a more central role in supporting the mental health of students when we're in areas where resources are limited.
I've always seen schools, teachers, counselors, any kind of mentor as always the first line of defense when it comes to addressing a child or teenager's mental health. And I think that um, in urban areas, they've done a really, really great job on having the proper understanding on how to treat um, kids with mental health issues. And in rural areas, I think that uh, it's definitely more important to have a deeper understanding because it's a completely different child, so to speak. Because when you're living in rural America, you're disproportionately affected by with poverty, and with poverty, there's a plethora of things that come out of that. Um, they're forced to grow up a lot quicker. Um, growing up in rural America, you're much more likely to experience a childhood ending event. And the way I define a childhood ending event is you have to step up as almost the head of the household. You have to look at your family struggling and think, dang, I gotta help my mom put food on the table. I have to be an asset to this family. Um, so I take care of my siblings and um, I help her out the best I can or um uh just how do I help my family that's struggling so much? So that detaches kids from their usual childhood or their usual schoolwork is why you see a lot of people in rural America just completely drop out of school and just work. So I think having an understanding of where these kids are and uh, change our strategy on addressing these issues would be really beneficial, as well as just cultivating a different understanding within the adults. Um, I know Julie said earlier that in places like these, there are a lot more. There's a lot stronger stigma. People usually aren't very receptive to these kinds of conversations, especially if it applies to their kid. Um, and that's where a lot of more unique challenges, like being part of the LGBTQ community, especially here in the South, it's definitely a really big thing for children to open up about that to their parents, which will cause another childhood ending uh, event. Um, so having schools be more of a safe haven for young people and young adults would be really beneficial because these kids and teenagers don't get that level of support at home or through their peers or their mentors or adults that they should.
I've been in schools for 17 years as a co-located therapist, and then less so in my clinical administrative role. Although I have to say that I think of purpose and I think of passion, and that is where you will find people with purpose and passion. And I recognize there is a lot going on in education, and that there is a lot of people fleeing, but there's also a lot of people staying in education and in schools. And there are a lot of people that are still going into this profession. And I believe that when I think of passion and I think of purpose, they are there for the children. And I think getting the tools into the resources of teachers, paraprofessionals, bus drivers, cooks, custodians, by teaching, programs such as youth mental health first aid, recognition of mental health distress signs. It really takes one ear. I often will tell the youth and the children if their friend walks them down to my room to talk to me, I said, it doesn't need to be me, but it needs to be an adult that you trust. Who can you talk to? Tell me one person that you can talk to. And if that is me, awesome. I'm right there for you. And if it's not, let's create a little bit of a safety plan. Who is your person? And so I think growing educational awareness and training programs within schools is just, I think, been really critical for our rural regions, because I am only in the school certain days. There is a lack of providers. There is a 1 to 2 hour, in our region, it's about a 2 hour drive to get to a day treatment. There is no day treatment, opportunities. There is telehealth. There's wait lists across the region, but it takes that one ear. Who cares? Who is the person who is carrying, I should say, and who can have the information with a baseline level of resource to get you to in the right path. And sometimes that is clinical or crisis or related services. And sometimes it is that empathetic, loving, hearing ear, and really the sense of community that I love living in a Northwest region of Minnesota. I choose to live here because there is so much passion and purpose, and that is just something that I want to continue to tap into with our educators and our school staff.
You know, and I think, Amy, what you just said is we've talked a lot about the challenges in rural areas, and there certainly are a lot, but there are also some strengths. And what you just mentioned is that there is a sense of community. People do care about each other in rural communities, and they do want to help each other. It's just knowing and maybe feeling comfortable doing that. And I just think, you know, going back to Jeff's story and what founded Rural Minds, if his nephew Brooks, who was 28 when he took his own life, if he had had that sympathetic ear, that person to talk to maybe at a younger age, because this is something that obviously had been going on for a long time, maybe that tragedy could have been averted. And that's just one of many, many. But I think that's looking at the positive side. That's where rural communities can play on their strengths to have that, you know, have those people that care and give them the information. And if Rural Minds can play a small part in that with the information we have available and the resources, because sometimes people may be looking for resources and not know where to find them, then that certainly helps to fulfill our mission as well.
I love everything that's been said so far, and I completely agree. I just want to reemphasize how much I think schools are really the place to be investing the most time, resources to supporting youth mental health. I mean, beyond that, at least at my school, we were able to provide free and reduced lunch and meals. So right off the bat, like schools are a place where people get food. So they're essentially like a grocery store, right? They also provide sometimes childcare programs and then also clothes. We had a closet at my school for any students who needed anything. And I can, you know, we can talk about mental health issues all day, but when those basic needs aren't met, young people cannot attend to those other needs in their lives. So just want to reemphasize that again, schools are a really great place for the practical side of kind of addressing mental health challenges and conditions that arise. One thing that was really helpful at my school, and this was actually born out of some of the advocacy that I had done there, but we found that when students went to their counselors and they asked to go see a mental health professional, they would get a referral. So referrals were great. Getting a referral was awesome, but 80% of those referrals went nowhere. 80%. That's 4 in 5 students who weren't connected to outside care. And so one of the things that my school district did was implement Care Solace, which is a multilingual mental health navigation service. And that basically takes young people from after that initial appointment with their school counselor, it takes them and their family and moves them to be connected to a mental health professional in their community or online or in some other venue that works for them. So making sure that that sort of handoff is warm, but also making sure that it happens in the first place, right? That is so, so important. Another thing that my school did that I think really promoted student mental health and well-being was kind of transitioning out of this model of extracurriculars into one that was more like, okay, we can actually use a class session during the day to dedicate to like extracurriculars. So we had a program called Sources of Strength, and they came into the school. They were actually like a full section during the day. So you would get credit for it, you know, it counted as an elective. And that was so huge because I know when I was in high school, I was like wanting to participate in some of these other extracurriculars that I'm sure would have been supportive to my mental health, but I had to go home and I had to stack wood for the fire later that night because it was winter and it was freezing. So being very candid about that, building in opportunities for student health and wellness promotion in class schedules is a really amazing way to kind of bring and generate awareness to that. Another idea, my school shared local crisis hotline information on the back of student ID cards. I've seen that in states across the country, and there's also a lot of movement on the federal level. So having that really centered is very, very important. And then I just want to quickly mention kind of the sort of like workforce challenges that I think are kind of underscoring all of this. So my school was really great in that we received an AmeriCorps, I think Vista volunteer who was able to kind of help lead some health and promotion activities on campus. And that was really, really incredible. and so important for schools where one counselor is managing basically the entire student body, right? There are so many report cards out there that basically say there is one counselor, one mental health professional for 4,000 students. And when you think about the size of a community like my own, that's the entire community, right? Like, we would not expect that of any regular person in any other job ever. So the workloads are just unbelievable. And one of the ways that my school tried to address that was by bringing in certified health educators from some of the other kind of creative community partnerships, but also just thinking about how community health workers can be really supportive to the work that's going on. Two things I want to mention very quickly. The University of Oregon, not to like harp on Oregon or anything, but the University of Oregon has the Balmer Institute, which is basically creating a 4-year mental health professional degree program. So it's not replacing sort of the needs of counselors, therapists, psychiatrists, or anything like that. But it is offering another way to kind of expedite the process into getting more people into schools and providing the healthcare for the immediate needs that are there, and then connecting to kind of further care, right? Kind of moving to that stepped model versus one where everyone needs to go through very intensive behavioral health care. And then the other thing, Youth Mental Health Corps, that is a partnership launched by Pinterest and I think AmeriCorps as well. That basically trains young people in communities across the country to, I think they either earn their, I think they get trained in mental health first aid, or they earn their like health, like community health worker certificate. So programs like that are very innovative. They work in communities and they're very great for rural areas where young people aren't necessarily getting access to mental health providers. Like they don't have an option to choose who to go to. So kind of giving more opportunities there has been amazing.
And something that I wanted to add, I know Trace was talking about how in schools, um, it's all about being connected, you know. Um, Everybody wants to belong to something. They want to be a part of something, and with schools, I feel like that's always been such a cornerstone of what it meant to be part of school. And in Arkansas, I know now that I'm a student at the University of Arkansas, it's a school of 33,000 students. So I'm getting perspectives, I'm having conversations with students that from corners of Arkansas I wasn't even aware of. Um, One conversation I had with one of my friends, he's from southern Arkansas, a town of no bigger than 100 people. And something that he told me, he was asking me what I'm involved in school with. I said, "Oh, I'm in the marching band, I'm in a quiz bowl." And he said, "Oh man, I would have loved to be in band." And I was just, "What do you mean you would have loved to? You could have joined your school band." No, man, we only had like 20 kids in the class. We didn't have enough people to make a band. That's the those those kind of groups is what defines a kid. It's what defines a teenager, is what they're a part of. I know I would have been a drastically different person if I wasn't part of the marching band or if I wasn't answering trivia questions for the Quiz Bowl team. And I think it's so important that schools get enough funding in order to have these kind of student groups or athletics, even if it's just a 5-person basketball team, or if they have a book club of sorts. It's all about belonging to somebody. Because as a teenager, you're experiencing tons of different feelings you've never felt before. Your your brain is firing off many hormones that you don't know how to deal with. And if you're, um, in a rural area where you feel like Trace said earlier, where you feel like nobody understands you, um, your thoughts get convoluted. You start feeling like you're drowning and that nobody's understanding you. So being part of something, any student organization or any a part of a group where people have like-minded interests is so important. Which is why I think schools have always been a great play such a central role in cultivating a healthy mind for teenagers.
Thank you, Max, and thank you all. It's such a good point, and so many parts of, those outside groups are shaping identity as youth and helping you figure out who you are and really building that resilience, building so many core values. And it's hard when there's not those same opportunities in these rural areas. And that belonging and connection is such a crucial part of this. And I want to kind of turn our conversation. I know we've talked a lot about what this looks like in schools. I want to talk about the community aspect of things. And I saw one comment in question in the chat that really touches on this in a nice perspective of on the other side of this lack of resources, which is a reality for rural communities, what kind of natural strengths of rural communities can we build on to support youth mental health? What is it about small towns that can be helpful to youth in these areas? And I think that's such a rich part of the discussion here as we look about at what kind of role the community in these rural areas plays in fostering resilience and community and that sense of belonging. So I just love to hear your thoughts on those rural area strengths within the communities.
Maybe I can start us out. We do have a lot of community and school collaboration because you can't take school completely out of the community conversation, but we have leaders. We have, our superintendents of our school. We have our county commissioners, our county directors. We have our social services, our public health. So there's so much happening in the communities. There is religious and faith-based institutions. There is booster clubs. There is it's just a lot happening, and it might be, far and few in some of these communities, but there is things happening. And I would say that something that we have found success with is something that's called Council of Collaboratives in our region. And that is where the leaders are all coming together. And they're finding a space to speak about schools, community, public health, initiatives. I think really from the community lens, getting information and support and resource and education out to parents and to families is just incredible. In one of the counties that we provide services, there is family resource centers that are being developed, and it is something that is new to this region. I think there's only a handful across Minnesota. And this is something that is offering support, education, resource, information right there to the families, to the community, open times. If you're already bringing to your child to, maybe your infant or toddler to a play and learn at the Head Start, or there is something there that is being offered for maybe they have a little one at home and they have a teenager they're concerned about. But there's resource information and things that are happening, and the communication across our small population, but large in heart and passion, is that if they continue to collaborate and communicate, and then try to provide things in the spaces that individuals are already naturally coming together.
Yeah, I think having the leaders in a community coming together, putting their strengths together to foster great mental health for young people is really the foundation of having a healthy younger population. Something that I've always said, and Amy said that this was going to come up, but social media. Um, there was this big just wave of enlightenment that's come across teenagers, especially in recent years, through social media. I've always said that social media is social engineering, and through Instagram posts or through just being exposed to so much information about how valuable mental health is and breaking down the stigma, it's certainly taken its effect in young populations. My biggest concern has always been, okay, now how do we reciprocate this with adults? How do we start breaking down the stigma, and how do we start socially engineering that understanding in adults? Because adults are always going to be the foundation for how their children turn out, or how accepted or how healthy their child is. Um, something that I've noticed in the last couple of years, and this is kind of coming out of left field, but music shows this trend. Um, there's a genre called Midwest emo music, which is very popular in the Midwest. That's just talking about I I'm trying to understand my feelings, and this is what I'm dealing with. And everybody that's listens to this music just starts getting an understanding of like, okay, I'm not alone. This is how I can start navigating my own feelings. And this just did wonders for the young people in the Midwest region. Um, that it just started giving people a lot deeper understanding of themselves and how they could start viewing other people. Um, I think that we don't have to necessarily use teenage means of instruction, or enlightening. Teenagers will always fall back to their apps, the Instagrams, the YouTubes, all that stuff. But something that I think that would really impact adults is start broadcasting the information and the importance of mental health through means that they're used to. Television, uh, television's super important. I don't watch a whole lot of TV, but I know my parents sure do. And thankfully, both my parents, my father's a mental health professional, so he's definitely done great for me, and my mother works at the school district. But I know a lot of kids have parents that just don't understand anything about mental health, especially for teenagers. And my parents are always on Facebook. So I think having a bigger presence of mental health importance on Facebook, especially within adults, because people are much more likely to understand something or take in information when it's coming from a like-minded individual. Um, so I think that having a community of adults or mentors or leaders that have a deeper understanding of what it takes to have good mental health would definitely mobilize everybody, our community, to take action and support our young people.
Well, Max, for someone so young, you're very wise. I just wanted to jump in there, and you're talking about ways to educate adults, and this goes hand in hand with supporting their children. And the Rural Minds has had almost since our founding a partnership with the National Grange, which is the oldest agriculture organization in the United States. And we are currently, and it's part of this resilience program, the National Grange is doing mental health programs at Grange halls all across the country. And so if if your parents are part of members of the local Grange, encourage them to have these programs in their local Granges, because that would be a way to get the information to the parents. Then hopefully they will be more open-minded when the time comes to talk to their children. I also like the music idea. I didn't know about that, but that's something great to know about, because I think you're right. Music can be an incredible way to empower people and reach them in a different way.
Max, I'm so glad you brought up Facebook because have you seen a rural GoFundMe on Facebook? Oh my goodness, they're so successful. GoFundMe's on Facebook in rural communities are so successful. And one of the biggest opportunities that I see for young people's mental health is to really encourage rural philanthropic activity, just because there are so many community members who are seeing these issues with their kids, with their neighbors' kids, and they want to help. They genuinely want to help. And maybe the only way that they can is by donating. So I don't know. I see that as kind of like a window of opportunity for how to support youth mental health causes, how to redirect those funds to then school-based health centers or other kind of like youth peer support programs or things like that. I think it is just such a gold mine that we're not talking about as much. And I think I mean, it just makes so much sense because polity is so much more forward in local communities, right? They aren't waiting for the state or the federal government to come in and offer them money or do things like that. Like they're doing things on the ground to make sure that needs are met. And so I think if we were to leverage all of the resources that are there, all of the funds, that would be really helpful, because I think at the end of the day, everyone who is in a community wants to live in a safe and healthy community. And I think that certainly involves mental health. There are some barriers with like making sure that mental health is understood to be health and kind of level setting those two facts. But I think it's just such an amazing opportunity for us to kind of change these conversations in a really profound way.
Yeah. And like you said, the GoFundMe's and on Facebook, they boom. Especially in the South. I'm sure I don't know if you guys know this term, but there's thing called Southern hospitality. And it couldn't be more true. I've put out GoFundMe's and everybody's just sending it around. Everybody just says, "Hey man, this is a really great thing. Let's pitch in." You know? And the thing with mental health community, what's so beautiful about it is that there's no sides to it. You know, uh, there's no, there's no difference between being a Republican or being a Democrat because we're all affected by it, and we could all come together and tackle these issues together. And when it comes to mental health, everybody understands that it's an issue. They just don't really know how to do it. Like Trey said, they say, "Hey, I'll donate," because that's what they feel like they can do. So I know a lot of people in the South are thinking, "Hey, I really don't know much about this at all. Here's $50. This is my pitch. You know how to use it better than I do. There you go." And I think there's just such a beautiful sense of community, especially in the South. And I know in all corners of the United States, it's such a, everybody wants to help. They just don't know how to help. Um, and yeah, it's a cool talking point.
Absolutely. I love these ideas and things that are being shared. It's really so insightful, and I cannot believe how fast our time has flown. We are almost at the end of our time. But I want to wrap us up just with one kind of final brief question of from each of you, just how do you see, I know we talk a lot at MHA of really focusing on those who are experiencing challenges being the ones who are at the center of the work, that lived experience is centered. And so I just would love briefly to hear from each of you how we can ensure that the voices of youth are heard and centered when we're really talking about these topics and designing interventions and programs for youth.
I'll jump in quick. I think that Max talking about the youth-friendly communication, that youth will have their platforms and to use them. And so to hear the voice directly from youth and adolescents, I think that is just incredible. That's social media, that is TikTok, that is anything that is currently being used to have an opportunity to get engagement. And I think that, inclusion in decision making is just critical. At our organization, we crave, we seek out the input directly from the youth, because that's how we can determine our next steps. What is working? What is not working? What do you need? What do I not see with my, with my lens that is needed? And so the other thing is, diverse representation. I don't think we've talked a lot about that, but I think that with youth, making sure that the voice of diverse youth is represented, and whatever platform can be, surveys, social media, any type of communication to get out to a youth and adolescents. It is so important to ensure the voice is heard.
I'm just going to second what Amy just said. I think the critical thing, and one of our focuses is on listening to the young people themselves. Go to the source, because young people know what they need, and so keeping an open mind and listening to the source, to the people that we very much want to help and want to serve.
Um, yeah, I think that we could ensure the voices of youth are heard and centered by giving teenagers a chance. Thankfully, throughout high school, I was given a great chance by my high school's administration of just grabbing the bull by its horns and just doing it how I thought would be the most beneficial. And there's tons of hiccups on the way. There's tons of hurdles that somebody has to go through, especially if they're doing advocacy or if they want their voice to be heard. I know personally, I struggled a lot with social anxiety. I couldn't get up to speak in front of a classroom of 20 people to save my life. And I know there's a lot of teenagers and kids out there who have so many great things to say that they just can't. Whether it be lack of confidence, whether it be they don't have, they feel like they don't have the support around them in order to project their voices. And it took a lot out of me to gain that confidence um, to be able to push through my own personal problems, to get better myself, so that I can now project my voice. Um, and I think cultivating cultivating somebody's advocacy or their confidence is the foundation of having the youth being based and centered when designing programs, interventions, or any kind of advocacy for that.
I think I would just quickly say to echo what everyone else has, but when we build for rural youth, when we build mental health programs, interventions, education, when we build them for rural youth, we reach all youth, right? Because it's a lot easier to adapt a program that's made for rural communities to urban communities than it is to take an urban centric program and then put it into a rural community, right? Let's have rural youth at the table. Let's crowdfund community resources. Let's pull together funds to get a youth on the board of directors for the Parks and Rec or for the activity center or for different things like that where young people are, where they can have a really great voice. I just think that's incredible.
Absolutely. Thank you all for that insight. Really keeping youth voice at the center, inviting them into spaces, uplifting their voice as adults. If you're working in a space where you're creating programs for youth, how are you bringing youth perspective into that space, into the planning, into all levels and stages? Such a great point. I just want to say thank you all. I know we could sit here a whole nother hour, 2 hours even, and keep diving in because there's so much to discuss. But I want to say a huge thank you to Max, Amy, Trace, and Julie for being here this last hour, sharing your knowledge, your insights, your resources. And a huge thank you to everyone who joined us, who was here participating in the chat, also sharing knowledge and resources. Such a rich discussion in there as well. I just want to make note that I know a lot of people were asking, this is recorded. We'll be sending it out to everyone within the next week. There were a lot of different organizations and programs that were mentioned throughout today. So we'll make sure that all of those links are also included in the follow-up so that you can take some time to dig into some of these resources that are available. And you will receive all of that information, like I said, by the end of the week. Just another thank you to our panelists for this wonderful discussion today. And we hope to have you all here again soon to continue on these types of conversations on this really important topic of rural mental health. So Max, Amy, Trace, Julie, thank you, thank you. And thank you everyone for joining us. We will see you back again soon.